taking a look at today's learning objectives. So basically, we're going to go over what Alzheimer's is and what other dementias are. We're going to see how Alzheimer's affects the brain. We're going to go through the risk factors. We're going to recognize the current FDA-approved treatments that can address some of the symptoms. We're going to go through different stages of Alzheimer's, and then we're going to talk a little bit about how scientists, what research is going on in Alzheimer's, to find a cure for it or find new medications. As we were talking earlier before the presentation, the FDA recently approved a new drug for Alzheimer's, and just so we're going to a little bit go over all the research and everything that's happening behind the scene. So let's talk about the impact of the Alzheimer's disease. We're going to start off by, checking what you know about the impact of the Alzheimer's on the United States. A question is going to come up on the screen here. So how many Americans are currently living with Alzheimer's? What do you think is the correct answer? Please go ahead and you can write it in the chat box. I'll give you guys a few seconds to put it into the chat box. What do you think is the correct number of Americans that are currently living with Alzheimer's? If you guys answered 5.8 million, that is correct. There's 5.8 million Americans that are living with Alzheimer's at this point. And by 2050, this number is projected to rise nearly to 14 million people. Another question. How many unpaid Alzheimer's caregivers are there in the United States? Again, I'll give you guys a few seconds if you want to go through and write down your answer.
I'll give you a tip. So most of the time when a person progresses, they're going to need more care, around the clock care. So if there is a certain amount of people affected in the prior question, there's probably going to be a higher amount of caregivers, because at some point you have to sleep, you have to eat, someone else has to take over if someone needs additional care. So just a tip if you're guessing.
All right, so we'll go ahead. So if you guessed $16.2 million, like Nicolette said, yeah, you definitely then need more people to take care of the people with Alzheimer's as they progress, So, and these are the people that provide unpaid care for people with Alzheimer's and other dementias. So this is basically your family members, friends who provide, care at no charge. So, that when you look at all those caregivers that are providing the care, there's about 18.4 billion hours of care that was provided last year, which if you value that 18.4 billion hours, you're looking at about $232 billion in expenses. So you could see how this takes a toll personally and financially. Let's learn a little bit about the facts about Alzheimer's. So now we're going to discuss more on Alzheimer's and dementia. So you hear a lot of times the terms Alzheimer's and dementia, they use interchangeably, but there is a little difference between the two. They are related, but there's a little difference. So in this section, we're gonna go ahead and we're gonna see what's the difference between dementia and Alzheimer's, what's different. But before we begin that, let's do one more question of test your knowledge. Alzheimer's is a normal part of the aging process. What do you think? Is that true or false? Give you guys a few seconds. Alzheimer's is a normal part of the aging process. Do you think it's true or false? If you answered false, that's correct. Alzheimer's is a brain disease that causes problems with memory, thinking, and behavior. It's not a normal part of aging. It's more than memory loss. It's progressive and it could be fatal. We're going to try another question here. People younger than 65 can get Alzheimer's. Do you think that's true or false? People younger than 65 can get Alzheimer's. Do you think it's true or false? This is true. There is approximately 200,000 Americans under the age of 65 that are living with younger onset Alzheimer's. We're going to go through that term a little bit later. In some cases, individuals develop the disease in their early 40s and 50s. Now what we're going to do is we're going to watch a little video of one of our experts, Dr. Heather Snyder, and she's going to explain how Alzheimer's and dementia are related.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So as we saw, there's many causes of dementia other than Alzheimer's. There is numerous types of dementias. Each one has a different symptom. So the ones that were listed were just few of the classifications. So this does explain how Alzheimer's and dementia are related. If you guys have any questions at this point, please go ahead and add that to the chat box.
Certainly having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
So that was one of the care partners talking about how diagnosing early is important for care for a patient with Alzheimer's. A diagnosis of dementia requires further testing to make sure what's the specific cause, that's causing the symptoms. So you want to make sure that we have an accurate and early diagnosis. So one of the questions that you might have before we do the recap is, what are the benefits of early diagnosis? So if you have an accurate early diagnosis, it allows you to seek additional medical opinions and advice of other professionals and the specialists. So you're able to get better medical care at an earlier part of the progression, which has a much better outcome. So do a little recap on Alzheimer's and dementia. Alzheimer's is the most common cause of dementia, but dementia is a general term for a collection of symptoms that are severe enough to interfere with the daily life. Alzheimer's is not a normal part of aging. It is a progressive brain disease. So that ends the first section. In the next section, we're going to look at what goes on the brain when Alzheimer's disease is present. So brain is the most complex organ that we have in our body. and it's also the most powerful. And despite it weighs only about 3 pounds, and is still the most powerful organ in our body.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So just to go back a little bit and go over what our expert talks about. So you may wonder, what's a plaque and tangles in the brain? So plaques are basically clusters of protein fragments that are in between your cells, and also, tangles is the twisted strands of another protein. It gets twisted, and that's what causes cell death and tissue loss in the Alzheimer's, and those are the prime suspect for that. So more than 100 years ago, Dr. Alzheimer described the specific changes in the brain, the formation of plaques and tangles. So Alzheimer's causes the nerve cells to die, which leads to shrinkage in the brain, which in turn causes the changes in the memory, thinking, and behavior. Next, let's take a look at the risk factors. So basically, everyone with the brain is at risk of developing Alzheimer's disease. But there are a few known risk factors that increase a person's risk of developing Alzheimer's disease. So let's see if you know which one is the most common. What is the greatest known risk factor for the Alzheimer's disease? Do you think it's genetics? Is it family history? Or is it age? Give you guys a few seconds. Go ahead, and if you want to type in your answer in the chat box. What do you think is the greatest known risk factor for Alzheimer's disease? Is it genetics, family history, or age? If you answered age, it's correct. So although Alzheimer's is not part of normal aging, age is one of the greatest risk factors for the disease. After age 65, the risk of Alzheimer's doubles every 5 years. 32% of people aged 85 and older have Alzheimer's. Again, not to say that they're not risk factors. All of the ones on the list here are known risk factors. Age is just the greatest known risk factor. Now we're going to take a look at one of our experts who is going to explain the most common risk factors with Alzheimer's.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's, and when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So basically, the only thing I want to mention from that video again is remember, Alzheimer's is not a part of normal aging, but age is the greatest known risk factor for Alzheimer's. Now let's take a look at some of the population who are at high risk for developing the Alzheimer's disease. Hispanics are about 1.5 times as likely as whites to develop Alzheimer's and other dementias. African Americans are about twice as likely to develop the disease as whites, and almost 2/3 of Americans with Alzheimer's are women. The reason for this differences is not well known or well understood, but researchers believe that higher rates of vascular disease in this age group may also put them at a greater risk of developing Alzheimer's. Women are more likely than men to develop the disease. There is 3.4 million American women are living with the disease today. So do a little recap of the risk factors. So age is the greatest known risk factor for Alzheimer's, and individuals' risk for developing the disease increases at age 65. Family history is a known risk factor. Having a parent or sibling with the disease increases the individual's risk. Two types of genes are associated with Alzheimer's. There's risk genes and deterministic genes. Hispanics, African Americans, and women are at an increased risk for developing Alzheimer's. Now we're going to talk about different stages of Alzheimer's, because no two individual experiences the symptoms and the progression of Alzheimer's disease the same way. We're going to hear from one of our other experts, Dr. James Hendricks, on why this is the case, and he's going to describe what it's like to live in the early stage of the Alzheimer's disease.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age. But we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
So if you ever wonder, what does living with Alzheimer's feel like? We're going to go through some people's stories who are currently living with Alzheimer's.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
I'm like an overachiever, and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor, and so that becomes a little disconcerting at times to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
So as we see, the individuals we just heard from, those are all in their early stage of the disease. Symptoms do worsen over time for everyone. However, remember what we talked about before is people progress through stages of Alzheimer's at different rates. Their abilities change at different rates. On average, a person with Alzheimer's lives about 4 to 8 years after diagnosis, but can live as long as 20 years, depending on other factors. Next, we're going to have Dr. Snyder. She's going to explain the 3 general stages of Alzheimer's disease. So let's go through the 3 stages.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So as mentioned, it's important to remember that the stages of Alzheimer's are general. And because each person living with the disease has a unique experience, we can't really always neatly place them into one specific stage. In fact, some people exhibit symptoms from 2 different stages, that overlaps. But the stages do allow you to gain a general knowledge or general understanding of the progression of the disease. As the Alzheimer's progresses, the individual's behavior will change, as does the role of the caregiver. So these stages can help caregivers prepare for what to expect and understand how to best respond. So do a little recap of the stages. So there's 3 stages to Alzheimer's disease, early, middle, and late. They're also sometimes referred to as mild, moderate, and severe in medical context. No 2 individuals experience the symptom or the progression of Alzheimer's disease in the same way. While symptoms worsen over time, people progress through stages at different rates as their abilities change. Next, let's talk about the FDA-approved treatments for the symptoms. Again, the key word here is treatment for symptoms, because as we mentioned before the presentation started, is there's not really any treatment that we have currently that does anything to reverse or stop the progression of the disease. What it does mostly, it helps treat the symptom to make your loved one more comfortable. So we're going to start out by seeing what you already know about the treatments for Alzheimer's. There are several drugs available to slow down the progression of Alzheimer's disease. Is this true or false? I kind of just gave this away, the last thing. But go ahead and, I'll give you a few seconds to go ahead and if you want to put it in your chat box. There are several drugs available to slow down the progression of Alzheimer's disease. Do you think it's true or false? All right, so this is false. As mentioned earlier, there is currently no treatment to prevent, treat, or slow Alzheimer's disease. However, several drugs are available to address some symptoms. Now, this may be changing. Let's see with this new drug if it actually is able to slow any kind of progression. So what we're going to do is next we're going to hear from Dr. Hendricks and he's going to go over the medications that are currently available.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
All right, as Dr. Hendricks said, so these treatments can help relieve the symptoms in people for a time because everyone experiences Alzheimer's differently. These treatments work differently as well, and it may not be effective for everyone. So you do need an early and accurate diagnosis to ensure that proper treatment is prescribed. If you misuse the drugs, it may lead to negative side effects. Now, this is, one of the questions that we get from any patients with Alzheimer's or their family members or their caregivers is why are they on more than one medication? Sometimes they're on 2 or 3 medications. So, it really depends on what stage you are at with the Alzheimer's disease and what your doctor is treating you for as part of your medical plan. But if you do have concerns, you definitely speak to your pharmacist that you deal with or your doctor to see why you or your loved one is on 2 different medications for the same disease, and how is that helping? Especially we see sometimes that patients are on multiple medications and there's no benefit. So that's something that you have to talk to your doctor to see at what time it's a good idea to kind of go off of that medication if it's not showing any benefit with the symptom relief. Again, the best person to talk to is, if you have your local pharmacist that can help you because they know you, they know your family member, they know their medications, they know, what you take, what's good for you, what's not good for you. And the second person would definitely be your general doctor or the specialist that helps you with, or your loved one with the Alzheimer's or any other dementia. So doing a little recap with the FDA-approved treatments. So as we heard, there's 3 types of drugs that are approved by the FDA to help manage the symptoms associated with the Alzheimer's disease. First one is the cholinesterase inhibitors, which is your Aricept, Exelon, and Razidine. The good thing about this class of medication is they're all generic and they're very, they're not expensive anymore because they're older medications, they're generic. So it is very cost friendly when it comes to, and it's a very good first line treatment for Alzheimer's, for mild to moderate Alzheimer's. The other class is glutamate modulators, Namenda. Namenda has gone generic about a couple of years ago. It's still, and that's also actually, it's not very expensive now. So that's also another good option to add for moderate to severe Alzheimer's. There's a combination medication out now with cholinesterase inhibitor and glutamate modulator, the Namzaric, which is basically, Namenda and Aricept combination, which is new. And and it's still expensive.
If you want to say the answer them at the end, but I just wanted to make
Dr.
sure.
Raval?
Yes, go ahead.
Okay, I see somebody in the chat has put in a question. How do you know if there is any benefit?
You would start seeing symptom relief. So what happens is a lot of times there's, how do I put this? You'll see that when people, start, when patients start losing their memories, they start losing, there's other behaviors that go with it. Obviously think about it in the general rule. Like when you forget like where you put your keys or something like that, you get frustrated because you can't find it and you need to go. So those are the things that you kind of notice, that if they're getting better at those things, that means the treatment is working, that it's not getting worse. They're getting some benefit from this where they are not agitated. That's one of the examples that you can look at, because there's those things that happen with that. Does that make sense?
Well, I think if there are further questions, we'll see them in the chat and I'll bring them to your attention.
Okay, perfect. So basically, as we keep talking, so these treatments only address some symptoms of Alzheimer's.
So
They
we
do
were
not
getting
treat
two
the root
people
cause of the disease.
because we were registered 32 and before we had 25.
Yes, yeah, I added them. I have them on here.
All right, so let's talk about the Alzheimer's research and the advances that are happening in the Alzheimer's research. So in the last decade, researchers have made enormous strides in understanding how Alzheimer's disease affects the brain. Many recent insights point towards promising new strategies for treatment, prevention, and diagnosis. And this is a proof that shows about, the new medication that's coming out. The association, it's working very hard to make sure we find new treatment. And I'm actually, personally, I'm also very hopeful for this new treatment that just came out. And hopefully this would be something that's a good start to get to the next level of medications that we need to stop the progression of this disease.
Dr. Raval?
Yes, go ahead.
That same person that asked about how do you tell if there's a benefit, has commented that his wife has been on Namzaric for 3 years and he doesn't see any noticeable benefit. And another person has a question about mood stabilizers.
Sure. So for the person with Namzaric, if you don't see any benefits after 3 years and you don't notice any kind of behavioral changes or any improvements in there, that's something you definitely want to talk to your doctor or the neurologist that's treating the condition to see what the next plan in treatment is. That's definitely something, especially if it's been 3 years, that's definitely something you want to talk to the doctor that we don't notice any kind of improvement. Sometimes you might notice a little bit more awareness, they're able to perform a little bit better on their activities of daily living, things like that. They're a little bit less frustrated. So those are the normal things that you look for. And if you feel that's not being improved, then you definitely want to talk to the neurologist or the doctor that's treating Alzheimer's, and definitely consult them and see if it is a good idea to continue with that medication, or maybe they need to be on something else.
And regarding a mood stabilizers?
Mood stabilizers in seniors, as a board certified geriatric pharmacist, I would say you only absolutely use it if you absolutely need it. A lot of mood stabilizers have a lot of side effects. One of them is drowsiness or dizziness that happens with a lot of them, which increases the fall risk for seniors. It is a big no-no from us to use those, but again, we do use them. I see a lot of seniors on mood stabilizers in nursing homes or even in the community settings. If it's absolutely necessary, where it could be something that they could harm themselves or anybody around them, yes. That's something that you can use, but you have to be very careful when you use any kind of mood stabilizers or even anything because what happens a lot of times with the seniors and Alzheimer's is you might even notice some psychological issues like schizophrenia or something like that. And that in that case, sometimes you do need some kind of medication for that. But we always recommend, if it's absolutely necessary, you use it at the lowest dose possible that shows any kind of benefit.
And a question has come up about Lexapro.
What about Lexapro?
I guess it's just a question about that medication.
So Lexapro is an antidepressant that they use in the elderly for mood stabilizing. You know, in general that they use it. It is safer to use, I guess, if that's what they're trying to ask the question. It's not the worst medication that you could pick. It is safer to use, but like I always say, if it's anything that's an antidepressant or a mood stabilizer or an antipsychotic medications, they shouldn't be used at all in elderly because it does have a lot of risk and side effects with that. But if it's something that they need to be on, then it is up to the doctor and and the family to decide whether it does. You look at the risk versus benefit. That's what it comes down to. Does that answer your question? Because
Yeah, yes, I think that does. They'll put something in the chat if not.
yeah, because let me tell you something. So one of the things that happens with the antidepressant medication and mood stabilizer, which are most of them like Lexapro, there's citalopram that they use. Lexapro is the escitalopram that they use. A lot of them, the most common side effects are usually they get dry mouth and dizziness and blurred vision, and it disrupts their sleep. So all of these things are going to make things worse for any elderly person because they're already suffering from all these things naturally, right? They already have, as you get older, you have problems with sleeping. You might have dry mouth. You might have blurry vision. You don't want medication that will make it worse. And then on top of it, it'll add a risk of fall, which again could make things worse for you. If you have any other questions, please feel free to put it in the chat. I'm sorry, I can't see the chat with my screen share, so please let me know, okay? Please stop me and let me know if there's anything that I need to answer right away. So now what we're gonna do is we're gonna talk more about the research. So we're gonna go through some of our experts here that's gonna let us know what's going on for, hope for the future for Alzheimer's.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past are things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
So as we just heard, there's a lot of hope for where we're headed with the Alzheimer's research. One of the key ways to keep research moving in the right direction is through clinical studies. We have scientists who are looking for new ways to treat Alzheimer's, and there's many drugs in the pipeline. This is a little bit older, so there's one just approved recently. They're working on recruiting and retaining trial participants. It's one of the greatest obstacles, other than funding, to develop the treatments.
Dr. Raval?
Yes.
I do have a question in the chat. It's a question about diagnosis. This person was told that Alzheimer's can't be determined until an autopsy is performed. Is that not the case?
No, I don't think so. That's the case. You could detect it. There's symptoms. There's scans that they do. No, I honestly I haven't heard that before. That the autopsy has to be done to detect it. No.
That was a years ago what used to be said. Someone has to pass away and they confirm it, they do an autopsy. That Dr. Raval is right, that is not the case now. So with pretty certain accuracy and comprehensive testing, they can see plaque and amyloid in the brain. They can do spinal taps, they could do imaging. It's a lot of what we recommend is very comprehensive at the Alzheimer's Association testing and looking into a diagnosis. We, of course, don't want to jump to Alzheimer's disease just because someone has memory difficulties or certain, Dr. Raval will teach in another program, our 10 warning signs. Just because you have some of the warning signs, we don't want to jump to that. We want to get lab tests. We want to see, is someone dehydrated? Does someone have a tumor? Is there something going on that maybe is curative or not? But we don't want to just assume that it is Alzheimer's. So there should be comprehensive testing done. And that is really important, getting that diagnosis. But it is something that we've come a long ways in, and that it is not just when someone passes away that we become aware.
So let's hear a little bit more from Dr. Fargo and Dr. Hendricks on what, a little bit more about the importance of the clinical studies.
It's more important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even a cure.
So it's very, very important that we have a yes, go ahead. Somebody had a question? Sorry.
Usually I leave the door open and let Dr. wait.
All right, so basically, this, as they mentioned, it's very important that we have people of diverse backgrounds that participate in this clinical research, because they are at an increased risk of developing the disease. It's important that researchers are able to study large populations of these individuals to better understand the disease and their elevated vulnerabilities. Now we're going to take a look at the association service that can help people find these clinical studies. It's called the Trial Match. Let's hear a little bit about it.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
So as we see, the Trial Match is an Alzheimer's Association program that can help you basically find a trial that you could participate in. And it's very important that different, like we talked about before, diverse background people, and also, even if you're a healthy individual, you should definitely participate because it does help with the research. If you're concerned about your private information, Trial Match does not share your information with all the studies. It's your choice to connect. And it's your choice to connect to a specific study, and all your
I
information.
think I should send out a thing to everyone as a reminder.
So we're going to do a little recap on advancing the Alzheimer's research. So scientists have increased their understanding of Alzheimer's significantly over the past decade. People with the disease, caregivers, and healthy individuals without dementia, they are needed to participate in clinical studies in order to find methods of prevention, treatment, and ultimately a cure. There are both drug and non-drug studies that take place across the country and online. Clinical studies may provide participants with cutting-edge treatment and additional medical care. Trial Match is free. It's a free clinical studies matching service for people interested in participating in Alzheimer's research. Finding a cure for Alzheimer's is difficult. However, no one has to face the Alzheimer's disease alone. You could definitely help with the research and see if you can find something to end this. We're going to learn a little bit more about the Alzheimer's Association now and how we can help individuals and family across the country. So the Alzheimer's Association is in communities across the country. As you can see the little purple map that came up. We provide direct service to individuals and families facing the disease. Our mission is to eliminate the Alzheimer's disease through the advancement of research, to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world without Alzheimer's disease. So how can you reach us? We're available wherever and whenever you need any reliable information and support. Our three top key resources is our hotline. That's a 24/7 helpline. It's 1-800-272-3900. We are also online at alz.org, and we are all over the communities nationwide as a community resource finder. So we're going to quickly go through each support line and see how it helps people.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. There's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
So as you can see, the phone line is 24/7. You can call any time of the day or night to get the information. We provide access to highly trained and knowledgeable staff who can help with education, decision-making, crisis assistance, and resource identification. We have master's level clinicians. They're available around the clock to provide in-depth care consultations. It's free service. It's free of charge. We do care navigation services. Everything is offered to the families, caregivers, or the individuals with Alzheimer's at no charge. And one of the best thing is the help is available in over 200 languages. So it really helps out a wide variety of population. Next up, as we mentioned, is our website. It's alz.org. It's usually the first stop now. It's the day and age of the websites in the internet is where individuals, go directly following the Alzheimer's or another dementia, once they get the diagnosis. We have sections specifically for people who are living with the disease, or we also have a section for the caregivers. So when you go to the website, you can pick either section. What we're going to do is we're going to hear from Teresa next, who's living with Alzheimer's, and what questions she had and how our website helped her.
When I went to the Alzheimer's Association website, which is alz.org, then I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And last but not the least is our community resource finder. You can go to our website, alz.org/CRF, which takes you to a wealth of community-based resources that are available in your area, which includes long-term care services, home care, any kind of community-based services, local association offices, they're offering in the support programs, everything that goes on. That's all offered at alz.org/CRF. Tom, who's also living with Alzheimer's, is going to share his experience with seeking help from the association and how he found his local resources through the community resource finder.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
The best thing about all these resources are it's free. There is nothing you have to pay to get any of these services or resources. They're all available at no charge to you. One of the ways you can join the fight is you can volunteer. We have a lot of volunteer opportunities. I am a volunteer community educator. There's a lot of support groups that happen, that you can work with the association. There is some events that happen. One of them is the walk. And there also, actually this month on June 20th, we have the longest day, which is an Alzheimer's Association event that I'm participating in it personally as well, doing some fundraising for that. And basically you pick an activity and you can do a fundraising. You can have your friends, family, anybody you can have with you to do that activity. And I'm going to be doing hiking for the longest day on June 20th. So I'm raising funds for that. And I have friends who are going to join me in hiking on June 20th for the longest day for the Alzheimer's Association. I don't know if Nicolette wants to add anything for the volunteer opportunities for the association.
Yeah, so it's so important that people get involved in these various ways. We all come together, work together, and the only way we can provide free programs, free groups, free helpline to help our families, our caregivers, our loved ones, our community members is by getting involved and doing the walk and doing the longest day. And the only way we can make improvements in policy and affect large change is through advocacy. And by being a volunteer, as Dr. Raval is doing, it's educating all of us, it's educating our communities, and there's lots of different ways to get involved. as he is in different ways. We need tech support. We need people that are willing to go to health fairs. We need people that are willing to facilitate support groups. So there's always a way to get involved that meets your needs. And we so appreciate that because we just can't do it all alone. We want to be able to help everyone that needs that support and needs those resources and needs that help. But we also need the community to come together and be able to reach those goals.
Advocacy is when you could help the Alzheimer's Association become the advocate for Alzheimer's. We can speak out on behalf of the needs
I thought I clicked it.
facing the Alzheimer's. We talked about Trial Match already. That's a free service that the association has, which helps you match 2 different clinical studies that are going on Alzheimer's. And Walk to End Alzheimer's, this is one of the other big events that the association held. It's held annually. And basically, it's one of the largest fundraisers to fight the disease. You can go to alzheimers.alz.org/walk to register for a walk near you. They have, I know they have a few around here in North Jersey. I'm sure they have down in Ocean County as well, where they have the local walk. So you kind of see when they have it, and you could definitely join it. And it's really fun. It's really fun to do these things.
Dr. Raval and Nicolette, we did have a question that, can you call the 24/7 hotline to ask for advice about dealing with someone with dementia or Alzheimer's who is irrational and angry? And I think someone else has chimed in and said there is emotional support available for caregivers on that hotline. Can you confirm that?
Correct. So it's a 24/7 helpline, and it's not at random people. So they are master's trained level. They can provide resources. They can provide crisis management, information, referrals. They can register you for a program or provide you with registration information. For example, Ocean County, Judy took the registration for this program. If you wanted to sign up, if you would have called our helpline, they would have directed you to Judy and to the website and the ability to do so. So it's a great opportunity. It's translated in hundreds of languages, and it's 24/7. So maybe somebody's just having a bad day, or they are in the middle of the night and they just say, I finally got a moment to sit down, and 9 to 5, I'm working all day. I really want to sign up for this program. I really want to get this resource I need, but I only have time at 10 o'clock at night. There is someone available live, will answer the phone. So yes, it is a great resource. And as I mentioned, for the 2 members that direct message me for resources, I will email them to you. Absolutely.
Yes, and you are the Zoom GNJ2.
Correct. They did send me their email directly, so I will shoot those out to them. My name is Nicolette Vasco, and I will send you various resources.
Thank you, Dr. Raval, and thank you, Nicolette, and thank you to all the people that have attended.
Thank you so much for having us. Thank you.
That was wonderful. That was really good. Thank you, everyone.
Support public libraries. Like, share, and subscribe for more great videos.